Hello, so this recording is going to be just PVD as promised. So here are our learning outcomes and objectives. So ultimately, you're going to utilize your intellectual and practical skills to care for a patient diagnosed with peripheral venous disease. Okay, our macro concept includes safety, always safety, adaptation, role of professional nurse, oxygenation, ventilation, circulation, and tissue perfusion. So the student learning outcomes or objectives are modified in this video just to those that relate to peripheral vascular disease, as I have taught PAD in a prior lesson. So for PVD, peripheral venous disorder, you will learn about phlebitis, venous insufficiency, DVT, venous ulcers, varicose veins, and be able to identify the manifestation of the clinical findings, as well as identify the goals of the care and interventions needed for this particular disease process. So let's begin. This picture shows you a picture of a person with a venous thromboembolism, and it shows you the swelling on a unilateral lower extremity in the first picture. Then it shows you the varicose veins in the second picture. You can see how each of these can be a body image issue for your patient, so be sensitive. Then you have the chronic venous insufficiency. So you see that discoloration, change in the texture of the skin. And then you have the venous ulcer. So the venous ulcer has this irregular shape. It's often like leathery-like skin surrounding the ulcer as well. Today we're going to talk about peripheral venous disorders. So we will discuss phlebitis, venous insufficiency, venous ulcers, varicose veins, as well as deep vein thrombosis. So for peripheral venous disease, it differs from peripheral artery disease because the blood is pooling in the lower extremities. Therefore, it has a problem with getting from the lower extremities or from the legs and the feet back to the heart. With PAD, it's a problem getting the blood to the lower extremities due to occlusions and clots. Okay, so let's talk about the pathophysiology of PVD, or peripheral venous disease. So you have muscles in your legs, they contract, they help the blood to return back to the heart when you are moving. So inactivity or standing in one place for a long time does not promote circulation back to the heart. Then you have blood that accumulates in the lower extremities, and this increases the venous pressure, damaging valves as well as the vessels. So incompetent valves allow for backflow or regurgitation to occur. So more blood is pooling in the lower extremities in those vessels, causing vessel dilation and increased pressure, damaging the lower extremity vessels and valves, preventing the blood from returning back to the heart because it is a backflow to the lower extremities due to the weakened valves. So some of our risk factors include advanced age, atrial fibrillation, chronic heart failure, pregnancy, prolonged immobility, varicose veins, smoking, abdominal and pelvic surgery, spinal cord injury, history of VTE, which is venous thrombosis embolus or emboli, prolonged traveling, like long trips on an airplane or a train without moving around, central or PICC lines. These are all risk factors for a venous thromboembolism. So venous thrombosis usually occurs with a unilateral lower extremity. You'll have pain, swelling, and erythema or redness will be seen. So I just want you to know that if you have a clot, a DVT, it increases the risk of a PE because the clot can break off and travel to the lung. So you always want to assess your patient cardiopulmonary status. So make sure you look for signs of dyspnea, pleuric pain, so any kind of chest pain, cough, syncope, or tachypnea. So these are all signs of a pulmonary embolism or a PE, and that may be due to a clot that traveled from the lower extremities to the lungs. Now, if your patient is having pain in their lower extremity, you want to advise them as well as their family members do not rub, massage that area. They may detach a clot. And also pregnancy women are at a higher risk of developing clots and hip post-op surgeries, but definitely post-op hip surgeries. So any kind of major bone surgery, you're definitely more prone to throwing a clot or even a fracture of a large bone. So here are some definitions. I know you guys know this from patho, but we'll just do a quick review. So VTE, venous thromboembolism, is a clot that's formed in the vein. DVT, deep vein thrombosis, is a clot formed in the deep veins, usually the legs. PE, pulmonary embolism, is a clot that breaks apart and travels to the lung. So Virchow's triad consists of three things. So these conditions increase the likelihood of developing a thrombus or a clot. So one, you have venous stasis or insufficiency. So poor blood flow returning to the heart. Hypercoagulability. So like such as when I stated that women that are pregnant are more prone to have clots or to develop a clot, as well as someone who had major hip surgery, or it could be related to medications that they're taking or some lifestyle habits or some diagnoses, some comorbidities. And vascular injury. So vascular injury could be from hyperglycemia, so having large levels of glucose in your blood vessels will irritate the blood vessels and cause damage to the blood vessels. It could also be from hyperlipidemia, so large levels of lipids in your blood vessels will damage your blood vessels as well. So with these three combinations, it's called Virchow's triad, and it makes the person prone, more likely to develop a thrombus or clot. So phlebitis is just as it sounds, inflammation of veins. So some of the signs of inflammations of inflamed veins or phlebitis include pain, tenderness, swelling. Your extremity may be warm to touch. You may see some redness radiating from the affected vein. And some of the interventions that you as a nurse can do to help alleviate this pain, if you were like a home care nurse caring for this patient, a warm compress to dilate the vein and to promote blood flow to the area. Monitor for signs of necrosis and infection. So if the vein is not getting the proper blood flow or oxygen and nutrients, that area will die. And if the area dies, it can also become infected as well. That's how some people develop venous stasis ulcers. Venous insufficiency. So venous insufficiency is when venous hypertension causes the vein to stretch and dilate and valvular destruction occurs. So the clinical manifestation of venous insufficiency is pain after prolonged standing, ankle and leg swelling, venous ulcers, uneven edges of the superficial wound, and it's a chronic non-healing wound. So these wounds, venous ulcers, have a difficult time healing. And you want to encourage rest, elevate legs so that gravity can promote the venous return back to the heart, and possibly alter the alter body image might be a issue for your patient because they have this wound. They may have swelling in the ankles and legs that they're unable to wear certain items such as shorts or a skirt or dress. So altered body image is definitely a real thing. Please make sure you talk to your patient about how they feel about, the changes in their body, and see if there's any other resources that you can refer them to kind of help them get through that. So next we'll talk about varicose veins. So varicose veins are distended, dilated veins in the lower extremities. These veins protrude, are usually dark in appearance, pain and edema after prolonged standing, a sense of fullness in the legs occur. Some special considerations is to encourage rest periods if they have a job or duty that um, have some standing in one place for a long period of time, that they are able to try to take some frequent rest periods where they can actually sit and rest their legs. Elevate the legs to promote venous return back to the heart. And this could also be a possible alteration in body image due to they have these protruding veins that are really doing their own crooked pattern. So that could be something that will prevent someone from wearing shorts or maybe wearing a dress or a skirt, and they may, feel that that's an image problem. So some of the treatment would include avoid wearing tight-fitted clothing. Weight reduction will help with that circulation coming back. Avoid prolonged standing, which this is really a main common problem with our varicose vein patients, our patients diagnosed with varicose veins. So please remember that. Elastic stockings are recommended to help with the blood flow back to the heart and try to prevent the vein dilation and distension. An injection of sclerotherapy may help with the varicose veins as well. Goal for peripheral venous disease is to heal any wounds and to decrease the edema. So oftentimes a compression wrap is used. The nurse applies this compression wrap to promote venous return back to the heart and to help reduce the edema. Bed rest and elevating your legs while in bed will allow for the blood flow back to the heart and reduce that venous pressure in your lower extremities. Oftentimes the patient may be on anticoagulants. If a clot is present and detected, thrombolytics may be used. Prolonged sitting and standing and walking are the culprits and usually the cause for this peripheral venous disease, because it contributes to the pooling of the blood, weakening of the valves, and the lack of muscle movement for the standing and sitting does not help with the blood to return back to the venous, back to the heart, causing venous pressure. So for skin ulcerations, a Una boot may be ordered. They may try to do a skin graft to see if that would help with wound healing. So here is a picture of a peripheral venous ulcer, or venous stasis ulcer, rather. So the nurse is responsible for doing the wound care as ordered. If the wound requires debridement, then it will be a debriding agent such as Santal or Dakin solution. In the event that it is clean and it has good, healthy, granulating tissue, then it would not, debriding agent would not be utilized. So please follow the physician's orders. Or if in fact you realize that the wound has improved and the orders need to be changed, contact your provider and ask for new orders in accordance to the progression of the wound, and vice versa. If the wound declines, you will contact the provider and ask for orders for a debriding agent as you notice some slough or something starting to form. Okay. Provide emotional support. As you see in this picture here, this is definitely a body image issue. The patient may even be embarrassed to allow the clinician to even change the dressing because of the way the wound looks and the way their legs look or feet look. So please be there, be sensitive, and provide emotional support. Educate your patient about their diagnosis. You want to always educate them about diet and anything that will help promote wound healing. So oftentimes patients are put on protein supplements to help promote wound healing, vitamin A, vitamin C, and zinc, or they may just be ordered a multivite to cover all of the vitamins to help with wound healing, and any type of medications that will promote circulation to prevent that venous congestion or pressure resulting in this venous stasis ulcer would help with wound healing. Okay, so reducing that edema. We already talked about elevating your legs to help with venous blood flow, returning back to the heart. You should advise your patient to protect their limbs from injury, their lower extremities from injury. Make sure they wear socks, shoes, protective clothing over their legs and feet. Do not cross their legs or wear tight clothing, because this could also hinder the venous return. And actually crossing your legs could cut off the circulation to a particular area in the lower extremities, causing more damage to that particular vein. Avoid heated devices and apply the compress from the foot up to the knee. So you want to make sure it's in a nice, even, sequential wrapping. So you want to just continue to wrap straight up the leg, not up and then back down. Make sure you go in one direction to promote the venous return. Venous stasis ulcer. So here is a very nice picture of a venous stasis ulcer. So it shows that leathery, discolored skin. So venous stasis ulcer results from chronic venous insufficiency. So the leg and the lower extremity, usually you see some edema. You may see some brownish color discoloration, or depending upon the person's complexion of their skin, maybe it could be like a purplish or reddish, but it's definitely discolored, hardened, leather-like skin. Stasis ulcers are usually at the ankle, and the patient's quality of life is affected. Again, this is a body image issue, so be sensitive. So let's compare and contrast arterial versus venous peripheral disease, okay? So in our peripheral arterial disease, you will have either an absent pulse or decreased pulse. If you cannot find the pulse, you would get the ultrasound, the Doppler ultrasound, to locate the pulse, and then you would mark where that pulse was found. Okay. Your patient may also complain of pain with walking or activity, and that's called claudication. And so your advice is for your patient to have a seat, rest for 10 minutes, and then resume activity. Okay, because you recognize that the pain is due to the lack of oxygenation. So the oxygen demand is higher than the oxygen supply because of the insufficient blood flow to the lower extremities. And you also recognize that collateral circulation is attempting to occur. So those small blood vessels are trying to reroute the blood around the occlusion or the partial occlusion so that the tissue can have the blood needed to live. So your patient may have a they may have thin, shiny skin. They may have painful ulcers, which are called arterial ulcers. So arterial ulcers are painful. They usually are more round or uniformed than venous ulcers. And so some of our nursing interventions would be to advise your patient to follow for exercise program. This increases the circulation. This will increase the collateral circulation development, and hopefully it will also prevent or prolong any complications related to this diagnosis of PAD. Your patient should avoid anything that causes vasoconstriction, such as nicotine, cold temperatures, caffeine. So just advise them of that. Anything that causes vessels to contract or constrict should be avoided because they already have impaired circulation to the lower extremities. So our problem is getting the blood to the legs and the feet for our PAD patients. So our legs should be in the dependent position for PAD to promote circulation down to the feet. So allow gravity to help your heart pump the blood down to the feet and the legs. Okay. Now for venous, our peripheral venous disease patients will have edema, because remember with venous, we peripheral venous disease, you have a problem with the blood returning back to the heart. So therefore, you have venous congestion, venous pressure build up in the lower extremities, which results in lower extremity edema. So they may have stasis dermatitis. So they may develop the different variations of color and texture in the lower extremities. The skin may thicken. They may develop ulcers, but these ulcers are painless. And these ulcers also have irregular edges. So peripheral venous disease, they have venous stasis ulcers, which are irregular edges and they're painless. Okay, when arterial ulcers are painful, so you should know the difference. So also in nursing interventions, you want your patients with peripheral venous disease to elevate their legs. So think of the V going up, their legs are going up for elevation. Why are we asking them to elevate their legs? To reduce the edema. This is a basic foundational nursing skill that you learned in foundational fundamentals rather. So you elevate the extremities to reduce the edema, okay? They may also wear compression stockings to help with the circulation returning back to the heart. As I mentioned a few slides ago, there's something called a compression wrap, where the nurse will actually wrap the patient's foot and leg and only going upward in an upward motion, will she wrap it, which is to promote circulation back to the heart. It kind of looks like an ACE bandage, but it is not an ACE bandage. It's actually called a compression wrap. Wound care. So you will follow the wound, the physician's orders the orders for the wound care by the provider. And weight management. So weight management may help these people, this population of people, increase their circulation back to the heart, and reduce the edema and the venous pressure in their lower extremities.